This is by far the most important video I will do now and in the future, because if I can help anyone cure their situation with Crohn's or colitis, it will be a win. If I can help anybody with their side effects or symptoms, it'll be a win. But I just wanted to make you aware this diet works. But at the end of the day, it's about health. It's about longevity and looking and feeling your best. And if you can cure a terrible disease that possibly could kill you, why wouldn't you do that? As opposed to taking medications and surgeries and dealing with infusions and all this crap that they're feeding us and trying to, deal with side effects of disease and not treating the disease. I promise you this diet will cure your disease. Do this diet. Ask me questions. Comment below. Share this with anybody that you think might have any issues like this or have signs and symptoms of Crohn's and colitis. I just wanted to do a little side note that this diet works. It maybe saved my life because it would have saved my grandfather's life, who died at 42 of complications of ulcerative colitis. And that's a fact. So please, any questions, comments below. But also hit that subscribe button and let me reach more people so I can try to help people lose weight, get in shape, and be healthy for tomorrow, for today and tomorrow. Thank you. Hey guys, my name is Todd Derry. This is TD's Fat to Fit, your free online strength and conditioning coach in your pocket. Today we're going to talk about something that is very important to me, Crohn's disease. I was diagnosed with Crohn's disease at 23 years old. I dealt with it for several years, but I cured it. And I don't care what doctor you're seeing, I don't care what hospital you go to, there is a cure. It is not a chronic lifetime disease that you have to deal with for the rest of your life. I promise you, it is curable. Most autoimmune disorders that they say are incurable, like type 2 diabetes, Crohn's, IBD, colitis, they're all curable. And it's all an inflammatory diet, as I've said in this channel 1,000 times, and you'll hear me say it 1,000 more. Processed sugars, processed carbohydrates, processed foods, any type of food that is inflammatory is going to cause this type of autoimmune disorder over time. Metabolic disease, type 2 diabetes, IBD, all of the autoimmune disorders are brought on by a poor diet, a standard American diet, which is basically all processed carbohydrates, sugars, and processed foods, factory seed oils, that sort of thing. So I wanted to go through a couple different things, the way I cured it, how I was diagnosed, my whole life experience with Crohn's. Wasn't that enjoyable, to say the least. I guess I had a pretty bad, I wouldn't say anybody that has a diagnosis of ulcerative colitis or Crohn's has it good, but from what I understand, my gastroenterologist said that my case was pretty severe. Whatever that means, whatever. I know it was severe in my world because it was debilitating at times, for a very long time, I should say. So I just wanted to talk about what I did to cure it and make sure that you know, and actually I want to ask you, if you know anybody that has this type of disorder or disease, please forward this video to them, because it could certainly save their life, help them actually cure it. Get off of all these crazy medications, all these biologic infusions, lifetime medications that the pharmaceutical companies love to put us on because they don't want to cure us. They want to treat us. They want to treat the side effects of the disease, but they don't want to make the disease goes away because it will stop their revenue. But as you know, I'm not a doctor. Cops be pulling up like I'm passing out drugs. Nah. I'm a bodybuilder, not a doctor. This is for education and entertainment purposes only. This is my experience over 35 years of being a coach and a trainer to countless athletes, from bodybuilders to physique athletes to strength athletes, from 17 years old to 75 years young. I've coached a lot of people over a 35-year period. I've been an IFBB Physique America judge, chairman, and promoter in New England. So I've seen the business end of the fitness industry, and I've been on the competitive end. I've been a competitive bodybuilder since I was 17. I've had my own weight loss journey multiple times in my life, losing over 100 pounds. It's different stages. I've helped many other people lose over 100 pounds. But the most important thing is health. At the end of the day, that's what I want this channel to be, is give you the cliff notes on what works, what will give you the healthiest, the best body that you've ever had in your life, and the easiest and quickest way to do that without reinventing the wheel. And that's what this channel is all about, giving you the cliff notes, how to become healthy, happy, and give you the best body of your dreams, the easiest way possible. Let's get into how to cure IBD, Crohn's, and colitis. So the agenda, we're going to talk about basically the anatomy. What is IBD? Brief explanation of the differences between ulcerative colitis and Crohn's. There's just a few differences in terms of where it is. Signs and symptoms, we're going to talk about diagnostic testing, the tests that you'd probably go through or have gone through, what I went through in terms of the tests that they did on me to show that I had Crohn's, and the diagnosis of Crohn's, what happened, and then my life with Crohn's, what it was like, and then considerations once I was at the point of surgery or changes in my life. What did I do? And then I'll go over the cure, what I did to get rid of it. And then again, please, I want to make this strong point. If you know anybody that has Crohn's or colitis, please share this video with them because it could save their life. My grandfather died from this disease. He died from complications in the hospital from ulcerative colitis. This could save your life. And I'm not trying to toot my own horn. This is just knowledge that is out there, but most of the medical companies out there, medical facilities and doctors have no idea this exists. If you go to a functional medicine doctor, they'll say, sure, there's a cure immediately, and they'll put you on a functional medicine diet and a low carbohydrate, no sugar diet, and you're well on your way. But that's functional medicine, and it's a whole different subset of medicine that nobody really knows about. If you go to a gastroenterologist, they're going to get you on biologics and all of these different drugs, and you're going to be on these for the rest of your life. This is 3 different pictures of the intestine or colon area. Obviously, the first one is the healthy, non-disease state. The second one is ulcerative colitis, which basically is the lower rectum and descending colon and the sigmoid colon. And then Crohn's disease, you can see it's a lot more bloody. The disease is a lot more significant in these areas, but it's patchy from a significant amount of area within the small bowel and gut. Ulcerative colitis typically affects the rectum and migrates north up the sigmoid and descending colon. It can be anywhere within the colon, but it's typically the most prevalent is within the rectum and sigmoid colon, which is basically the turn right before the rectum. It affects over 1 million patients in the US. Typically, you have fatigue, painful cramping, pain during bowel movements. Bloody diarrhea is common. Fecal urgency and nocturnal bowel movements are prevalent. Lesions are shallow, and this is one of the significantly different things about Crohn's and colitis. In colitis, it's more superficial. It's isolated to the submucosal and mucosal layers. It doesn't go any deeper than that. So the inflammation is mild, and it can develop into fibrosis if left untreated. Colon looks smooth like a pipe, and the haustra, which basically you see in this picture, those little folds within the colon, those are called haustra. The inflammation pushes those away, and it kind of makes this smooth pipe look. So when you get a significantly diseased state or colon, that becomes more smooth without any haustra folds. Ages, typically you start around, diagnosis is around about 15 years old up to 35, and then there's a lapse, and then you typically see more patients being diagnosed at like 55 to 70 years old. So there's 2 different groups of patients that finally develop ulcerative colitis. Let's talk about Crohn's. Crohn's is a little different. Crohn's most prevalent, as you can see this red X, is the terminal ileum. That's the most prevalent Crohn's disease comes in. However, it can be within your rectum, colon, small intestine, gut, esophagus, all the way up to your mouth. Crohn's disease can be anywhere from your mouth to your rectum. Patchy chronic inflammation, it's not like one large section, it's just patchy, really severely diseased areas. The most common in the terminal ileum area, which is the last 10 inches of your ileum before it goes into your ascending colon. Affects about 3 million patients in the US. Bloody diarrhea is less common than ulcerative colitis, but it is common, but it's just not as significant. My case, not so much. I was filling a toilet with blood every time I went to the bathroom. It was like a crime scene, and that's not an understatement. I'm not exaggerating. It was horrendous. Severe lower bowel pain is constant. Belly pain and cramping is constant. It's terrible because you never can get comfortable. Lesions are transmural, meaning it affects all the way into the muscle layer. So it can create these huge ulcers through the mucosal, the submucosal, into the dermal layer of the intestines, and all the way into the muscle layer on the outside of the lining. So it can develop ulcers all the way through. Developing fissures, you also get this what's called fat wrapping, which kind of comes around the diseased intestines to kind of encompass it and develop some type of protection around it. Inflammation is severe. It turns fibrotic, obviously, if left untreated, and you get this cobblestone effect, not like a smooth pipe, which we talked about in the ulcerative colitis. This becomes patchy and cobblestone because the ulcers are so bad. Fatigue and fever is constant. You walk around with fever all day. You just walk around with a mild grade fever. It's awful. Weight loss, malnutrition is common, obviously, because you're not going to be eating because it hurts so much. Fecal urgency and nocturnal bowel movements also prevalent, and the age development of Crohn's is the exact same, 15 to 35, and again, another subset at 55 to 70 years old. Why that is, I don't know. I'm right in that. I was diagnosed at 23. So that was 25 years ago. So here's some testing that you would typically deal with. You get an ultrasound, you get an upper GI barium, which is terrible. You take this barium drink with these baking soda crystals, and you have to hold it in without burping, and it basically expands your esophagus and your gut, and they take an x-ray of that. You can do that both on upper GI, and then the lower GI is barium drink. You got to drink it, and then you sit in the office for 3 hours waiting for it to migrate to your small intestine, and then they take another x-ray. I don't know. They're not very good. Listen, I've been in the medical industry for 25 years. I've sold x-ray. I've taught ultrasound. I sold MRI, I sold CT, I sold mammo, I sold bone density. I've been in the medical imaging world for 25 years. I know medical imaging like the back of my hand. I taught ultrasound guidance at Harvard for several years. I know this stuff like the back of my hand. And x-rays don't really give you much info. Breaking broken bones all day, perfect. But you're not going to see a skin lesion, you're not going to see a bowel lesion or any type of ulcerative colitis or Crohn's with an x-ray. Just doesn't show it. So these are more tests. You get an endoscope or colonoscopy or colonoscope. You get CT of your abdomen. I also got a CT. You can take a pill, what's called a pill cam. But the problem with a pill cam is it's not directed. It's just this random picture that as it flows through your small bowel, you could pass through disease states and not see them. So it's not perfect. It's a good idea. I almost worked for the company at some point in my career, but it's not a perfect science. The best way to get diagnosed with Crohn's is an endoscope, which is either a scope down your throat or a scope up your butt, the colonoscopy. Also, there's another way of treating and seeing the disease, which is through surgery. So they can actually look at it through opening you up, but that's the last resort. It's not something you want, which would be a bowel resection or a colectomy. So IBD testing, a colonoscopy is your best bet. Sigmoidoscopy will go up your rectum and check out the sigmoid and descending colon, but it only goes about 12 to 24 inches in, and then it stops. But that's the difference between a colonoscopy. Colonoscopy is 48 to 72 inches. Depends on how far you can handle the pain to get it to a certain area. But the colonoscopy can go up the sigmoid, up the descending colon, through the transverse, and down the ascending colon. And then it can look around into the ileum, the terminal ileum. And that's how I was diagnosed, is because the ileum, my last 10 inches of my ileum was so ulcerated, it was just so obvious. He said he could count like 200 ulcers in the last 10 inches of my ileum. Basically, what he was saying is it was completely diseased. The last terminal part of the terminal ileum was 100% ulcerated, diseased Crohn's. And that's why I was in so much pain and bleeding so much. So you can go through all of these testing, but these are the most important ones. These are the ones that will diagnose you, no question. All the other ones are, oh, well, we need more testing. And then finally go to the point of doing a scope. My specific tests, I was 23, it was 1998. I had a stomach ulcer. I ate some bad food and it gave me diarrhea. So it leached out all the good bacteria and all the protective layers in your stomach. So I got an ulcer. But I didn't realize that was going to develop into something more. I had a really stressful job and I had really a lot of weird things going on in my life. So that stress plus the ulcer leached out all the good bacteria out of my system. And without the stress of that, I developed Crohn's. So I was constantly just in pain. I didn't know what was going on. And then I would go to the bathroom and there would be some blood in the toilet. And I just thought, this is not good. So I finally go to the doctor and they start to do all these tests. But at first it was to rule out cancer. And at 23 years old, the last thing you're going to worry about is cancer. So when they're talking about, oh yeah, we got to worry about cancer, I'm like, what? I'm 23. That's not supposed to happen. So kind of adding to the stress. But again, I had an upper GI, lower GI, ultrasound, CT of the abdomen, sigmoidoscopy first. Couldn't see anything, so he went into the colonoscopy, and then they took stool culture, and then blood tests. Had blood tests once a week. If I had them once, oh my God, I probably was stuck 100 times for 100 blood tests. It was crazy. The stool culture came back with zero evidence of good bacteria. Zero, none. And that's how bad my disease was, because I had no protection. Basically, the flora, the microbiome, the gut flora within your small bowel is the protective layer for the acids and all of the food that you eat. It's what gets absorbed, and then they allow nutrients into your small bowel. So if you don't have any good bacteria, it's just going to drive you crazy. It's going to become diseased at some point. And I had all E. coli. So I had a severe E. coli infection without any protection from good bacteria. So obviously it developed into Crohn's. I was taking 4 Pentasa 4 times a day, which was basically this anti-inflammatory drug. I was taking 50 milligrams of prednisone a day, antibiotic treatments, probiotic pills and pain pills, just ibuprofen and Tylenol to try to help the fever. And then I was on tons of Prilosec and Nexium, I think, PPIs to help with the acid, because they felt, oh, get rid of the acid, get rid of the pain. None of it worked. I was taking so many pills, so much per day, that I would go to the bathroom. It would be all blood, 100% blood, and it would just be these white pellets in the toilet. Because again, I had no ability to absorb the medicine because I was bleeding so much. I would just eat something, it would go right through me, and it would come out the other side as little tiny pellets. And I'm like, are you kidding me? And it was just getting worse and worse, and week after week, I couldn't walk around with my pants buttoned because just the pressure of my underwear hurt. It was terrible. I feel so bad for anybody that has an IBS or IBD, Crohn's colitis. It's a terrible disease. It's a terrible way to live. And to think that you're going to have to deal with this for the rest of your life, when I cured it in 3 to 6 months and I don't have it anymore, that's a true statement. 3 to 6 months and I was good, cured. And this was 25 years ago, and I'm not the only one that I've helped. So this works. I promise you this works. Please share this with somebody that you think has this disease, because it can possibly save their life. Also, any questions, put the questions down below and I'll certainly try to get back to you, or I'll make another video. If I missed something, please let me know and I'll make another video on whatever I did that I didn't hit on in this video. Remind me and or ask me a question. I'll certainly do that. So the medications didn't help me at all. The surgery was basically my next alternative move, because I'm on these Crohn's forums, and these people are going in for 19, 20, 25 surgeries because they would go in and cut out a section, the disease section of your intestine, which now means you're on a lifetime amount of vitamins and minerals that is absorbed in that section of intestine. So you can't just cut out a piece of intestine and just go about your business. Number one, the disease is still there. It's going to come back in probably 12 to 16 months. And that's why you hear patients that have like 25 surgeries. What? So this is my first surgery on 20 in a lifetime? Are you kidding me? No way. There's got to be something else we can do. So I called my doctor, was telling him things are getting worse, that the pain is terrible, and he said, come in. And at the time, he had talked to a nurse practitioner, a holistic nurse practitioner. And she came in and told me, you should read a book and look at trying to treat this in a natural way, because they were seeing that my reluctance to get surgery. I just didn't want to do this. I wanted to try something else. And from my bodybuilding worlds and my dieting worlds, I thought, I can do any diet anytime, no problem. I'll jump on a diet tomorrow. What do I need to do? The online forums is what basically kicked me over the edge to say, no, Moss, I'm not going to get cut open until it is my only last option. Fever, shivering, sweating, go lay down for a half an hour, and then I'd finally recover, and then the fever would come back. And it was just a constant issue all day. And my pain was just constant, 3 to 5 on the pain scale all day. And then going to the bathroom was just awful. It was horrific, not to mention the amount of blood I was losing on a daily basis. So it was time for a big change, and I was ready for it. So surgery, no, not going to do it, because you only get 12 to 18 months. But the diet, it was basically recommended that I read Specific Carbohydrate Diet, or scdiet.org. I read the book, take the recommendations. Most of the book, it's just a couple of days read. I mean, you could probably read it in a day. It's mostly recipes and foods in the book that you can eat. It's stated that 6 to 8 weeks you get major improvement, and you could be symptom-free in about 6 months. It was very interesting, but it wasn't impossible, but it was just a limiting diet. And in today's world, we know that diet as a real food diet. No processed foods, no factory foods. And as we know, that's all we eat in today's world is carbohydrates, sugars, factory foods, factory fats, or factory industrial fats that are just terrible for our system. And the simple cure basically is to get rid of any processed foods, sugars, refined carbohydrates, and reestablish the microbiome and the flora within your gut. You may have H. pylori, you could have SIBO, you could have E. coli, all of these different infections. So you got to get rid of the infection, also treat it, and get a new proliferation of good bacteria, and quit the factory foods. Get rid of the processed foods. Speak to a functional medicine doctor. Stop eating sugar, refined carbohydrates, and processed foods. Rice, potatoes, grains, wheats, flour, anything that comes in a box or a bag or has sugar in it, do not eat it. You might need an aggressive antibacterial treatment to kill off the bad bacteria, but that's not a big deal. You'll definitely need to start with a multi-strain probiotic treatment and probiotic fiber, probiotic foods like AG1 is a good one, and there's another one, Greens, I think. It's just called Greens. So these are good food for good bugs. Read the book, start the diet, and trust me, you'll be, in my situation, this is the diet here. This is the book, Breaking the Vicious Cycle. And you can read the book, but it's really much easier than that. Because as long as you just eat non-processed foods and get rid of sugars and carbohydrates, this diet will work. You can go through the process of making your own yogurt and, going through the book and doing as the book says, that's fine. But as long as you're eating all whole foods, if it was green or God made it, you can eat it. And other than carbohydrates, rice, potatoes, and starchy vegetables are not optional. That's no-go. You can't eat that stuff. So things you can eat: steak, chicken, eggs, fish, shellfish, hard cheeses without lactose like Parmesan, Swiss, Gouda, feta, cheddar, blue cheese, provolone, Colby Jack. No cheese that has lactose. Nuts are fine: cashews, almonds, peanuts, pistachios, macadamia nuts, walnuts, pecans, homemade yogurt. I made some badass homemade yogurt with strawberries and blueberries. Oh, so good. And you buy a yogurt machine, you buy some cream or milk to add it into, and you just buy a non-processed milk with the cultures, and then you add whatever fruit you want, and you're good to go. All fibrous vegetables, lettuce, peppers, onions, cucumbers, celery, sprouts, mushrooms, all are fine in my world. They worked for me. I ate that stuff. It was fine. My recommendation is no fruit, no citrus fruit or apples or bananas. Those are too much sugar. Strawberries, blueberries, blackberries, those are fine. So the book says you can eat fruit. I would say you shouldn't eat fruit. It's all in the way the gut processes certain fiber and such, so that's your choice. But again, you can probably get away with it. But if you don't, you'll probably just get that much better, that much more quickly. Again, no rice or potatoes, no juice, no milk, no lactose. All of those things have a ton of sugar. And then a new, as I've said in my past video about BPC 157, there's a new supplement out called BPC 157, Body Protective Compound. This was designed and discovered as the protein or peptide that calls for gut healing. And you can buy this stuff and supplement with it, and miracles happen. This stuff can then is so anti-inflammatory, it can heal tendinitis in your elbow in days. Things that you've been dealing with, knee tendinitis or certain joint pain, shoulder pain, sciatica, you name it. I've had a client have this type of pain, and BPC 157 healed it within 1 or 2 injections. The stuff is amazing, but it's rooted from gut health, gut healing. And we didn't have this 20 years ago. This is a brand new medicine. You can take a bath in it. There is no side effects, and it cures your issue, whatever it is. So if I had a stomach ulcer out of the clear blue, not only would I get rid of sugars and carbohydrates, but I would get on a serious treatment of BPC 157. Or if I had some gut inflammation or I contracted H. pylori, I would get on BPC 157. With the anti-inflammatory diet or no starch, no carbohydrate diet, supplement with BPC 157, and I guarantee you, you'll be on your feet really quick. So conclusion, symptoms slowed for me within a couple of months. I was symptom-free in 6 to 7 months. My symptoms slowly went away in 2 months, and I was symptom-free 6 to 7 months later. All medications were gone. Prednisone, gone. Pentasa, wasn't taking it. I was taking vitamins and probiotics, and that was it. I ate this way for about 2 years, and then I went to a Thanksgiving where my grandmother made apple pie, and man, I destroyed that thing. And I went back to eating the same way. I didn't get to Crohn's disease again, I just got fat. But this shows you the power of this diet. I cured Crohn's. I've had 2 colonoscopies and a sigmoidoscopy since, and I am the first patient in 35 years of practice that my gastroenterologist has declared cured of Crohn's. Never once before has he declared a patient of his cured of Crohn's. I'm the first one. And it just so happens that I've helped a couple other people with IBD also cure it. So I'm not special. I'm not different. I'm not any different than anybody else, but I just know how to eat right. And knowing how to diet and knowing how to do something more seriously like this, and I'd say I would much rather eat this way than take handfuls of medication and suppress my immune system for the rest of my life and having to dish out all this money for medications until the day I die to suppress my immune system to make this disease go away, or I can just eat differently and get rid of the disease and be cured of it. Any questions, comments? Do you have IBD? If so, are you still dealing with it? What are the medications they are on in 2024? What kind of biologic infusions are you taking? How much does it cost? I've heard it's $30,000, $50,000 a year that obviously insurance is paying for it, but you got to be out of pocket at some point. You can just cure the disease. You can make this go away. I promise you. So please hit that subscribe button. Help me grow this channel. I appreciate your time. Hopefully you learned something. My name is Todd Derry. This is TD's Fat to Fit. Until next time, I'll talk to you soon. My red light went out. Blue one, he's good. Red one, slack. Total slacker.